Welcome to beautiful Vienna, Austria's great capital and largest city. This year, Vital Options International took on its 6th year of the on-site coverage of the signature gathering, the essential ESMO ECCO Congress. The European Cancer Congress combined the efforts of the most important European oncology professionals with the aim of improving the prevention, diagnosis, treatment, and care of cancer patients.
For almost 5 years, from 2008 to 2013, 1/3 of the priority 1 essential cancer drug list, so 1/3 of the cancer drugs there have been missing. And we're talking drugs like vinblastine, dacarbazine. We're talking drugs with a cost of €7 and €14 and €25, bleomycin. And we're talking really cheap drugs. And that was one opportunity for us as patient advocates, first to help patients just buy the medicines, either in Vienna or in Hungary or wherever we would find, either in Brussels, wherever we would find them at a lower cost, and simply get them to the patients in Romania. Mm-hmm. Now, after we did that for, as I said, 4 to 5 years, what we've started afterwards was an extraordinary movement, which is unprecedented as far as I know in Romania. With the help of some really talented journalists, we started an advocacy campaign. And one of the essential pieces of evidence that we've had in there was first of all the reports by patients. And we had a list of all the patients that had received the medicines, and there were over 1,500 who received the medicines through this network of volunteers. And we had the essential cancer drug list of the WHO. So these were the two arguments were showing that this is not acceptable. And you might ask yourselves how was this possible, and what was our role there in this whole picture? I can tell you that there was not one oncologist in the whole Romania, in the whole country, that didn't know about this shortage of cancer drugs, and there was not one hospital who didn't know about it, and there was not one of the 5 health ministers that were there that didn't receive a report on that, and nobody did anything. Mm-hmm. We may ask ourselves how this happened. This wasn't a problem for anybody. The doctors had other problems, and most of all, patients didn't want to talk in order not to upset their doctors. Doctors didn't want to talk in order not to upset their hospital managers. Hospital managers didn't want to talk about it in order not to upset the ministry. Mm. So we have thousands of patients not receiving really the most essential cancer drugs, and we have doctors who are not being able to treat their patients properly, and all those people they didn't speak about it because they were afraid. Mm. Now, I think that's one example of what patient advocates and patient associations are there for. Mm. I think it's that independence that you have, that power of the person who is directly involved or whose closed ones are directly involved. So eventually, we got the help of the media. Eventually, we got the help of some doctors. Eventually, some patients had the courage to speak up. And we had the essential cancer drugs list of the WHO, where, if I may comment on the discussions earlier with regard to which drugs should be reimbursed and which not, and which drugs are coming on the essential cancer drug list. Those drugs which I have seen there, especially the ones in priority 1 and priority 2, I think there are 3 of them, right? Priority 1, 2, 3. Those are really, really inexpensive cancer drugs, and cancer drugs which have been around for decades. Mm-hmm. So I think that's the main feature of this essential cancer drug list. And I think if you ask me what we should do about it, I think we should do 2 things. We should first implement some reporting lines there is no monitoring of this entire shortage problem that's happening everywhere. It's happening in Eastern Europe, and it's happening there every day, and it's happening in Germany even, and in other rich countries. Now, the thing with cancer drug shortages and drug shortages in general, in my opinion, is that they don't happen. I mean, the government doesn't treat patients, so you don't necessarily have the government never has a problem. There's some doctor in some hospital who has that problem. They need to report that. They need to be obliged to report that, because otherwise the responsibility on this person is too big. They can't we can't expect doctors and we can't expect patients to report if a cancer or every cancer drug shortage or every drug shortage in general. So there has to be a monitoring system. There has to be a reporting line. And the second thing, in my opinion, is standards of care. What the gentleman in WHO is trying to do. So establish some standards of care maybe at global level. Of course, it would be great. But in Europe, in such a rich continent, actually, we should have at least some standards of care for cancer drugs. Maybe for radiotherapy, Fatima mentioned earlier, the country in Africa, I can tell you in Romania, we have 1/10 of the radiotherapy equipment that we should have, if you take the standards.